iodine, right? To produce T3 and T4, you need iodine. Now, if someone doesn't get iodine from the food, then T3 and T4 will not be produced. Okay? If T3 and T4 are not produced, tyrosine will not be used up. Make sense? Because to produce T3 and T4, you need what? Tyrosine. Iodine and tyrosine, they should join together, right? Now, if no iodine, tyrosine will not be used. Will stay inside the follicles. Make sense? And will start to build up, accumulate, because they are not being used. So, the amount of tyrosine will gradually increase inside the follicles. Is it clear? And the follicles will get what? Bigger. So, when all the follicles inside the thyroid gland will get bigger, the thyroid gland will get bigger. Make sense? Due to accumulation of tyrosine, that amino acid. Now, if you give iodine-rich food to that person, then what will happen? T3 and T4 will be used. Tyrosine will be used up, right? So, will shrink. So, easy. So that's why you see like hypersecretion of thyroid can lead to a clinical condition that is called Graves' disease. First was identified by a physician whose name was Gray, Dr. Gray. So, in 1837 or 38, he first diagnosed this clinical condition. Hyperthyroidism can lead to Graves' disease. And just know that what happens in Graves' disease, the fat accumulates in abnormal areas of the body. Fat accumulates in abnormal areas of the body. So now you tell me, if fat accumulates, this is one abnormal area where too much fat accumulates in Graves' disease in the back of the eye. So that fat does what? Pushes the eyeballs outwards, forward. Make sense? Because more fat accumulates behind the eyeball. So if you look at the person, it will be like, protruded eye. Eye is pushed outwards. Make sense? Forward. And that can lead to painful condition, right? In the eye. Sometimes redness in the eye, you will see that due to pressure. So that is one location where fat accumulates in Graves' disease. Since it is a condition related to hypersecretion, so hyperthyroidism, right? So all the symptoms of hyperthyroidism, like high blood pressure, high increased heart rate, right? Increased metabolism, weightless, losing body weight. So all those symptoms are also seen in Graves' disease. Is it clear? Okay. Now we'll talk about the parathyroid glands, 4 to 8, attached to the back of the thyroid. So in the back of the thyroid gland, we see small parathyroid glands. Parathyroid glands produce parathyroid hormone. Very simple. Parathyroid glands produce parathyroid hormone, also called parathormone, PTH. Same thing. Just know that its action is just opposite of calcitonin. Calcitonin is a thyroid hormone, right? Remember, that lowers the calcium in the blood. Parathyroid does just opposite. That means what? Increases the calcium in the blood. Make sense? So by the action of calcitonin and parathyroid hormone, the blood calcium concentration is maintained, right? So if blood calcium concentration goes up, calcitonin will be released to lower it. if concentration of calcium in the blood goes down, then parathyroid hormone will be released to move it up. Is it clear? Now these two hormones maintain the blood calcium. Blood calcium concentration must be maintained between 9 to 11 milligram per 100 milliliter of blood or 1 deciliter of blood. This is the concentration of calcium. Okay? Very important mineral in the body. Very important mineral in the body. Have you heard the term hypocalcemia, hypercalcemia? Right? If the concentration of calcium is below 9, that is called what? Hypocalcemia. Is it clear? If above 9, hypercalcemia. Both are risky. Calcium is very important. So if the concentration is below, that can lead to paralysis of the muscles. Paralysis of the muscles. Particularly the respiratory paralysis, right? If the respiratory muscles are paralyzed, then dangerous, right? The person may die. So, very important, calcium. Calcium also controls the nerve signal transmission, controls the secretion of neurotransmitters in the body. So those are other important functions of calcium. Okay, now you see here the back of the thyroid. These are the parathyroid glands. Okay. How the parathyroid hormone increases the blood calcium? Parathyroid hormone works on 3 organs, 3 structures in the body. Number 1, parathyroid hormone works on the bones. Number 2, works on the kidneys. Number 3, works on the intestine. Okay. Parathyroid hormone or PTH works on these 3 structures and increases the calcium. On bones, parathyroid hormone increases osteoclast activity. Increases osteoclastic activity. How many of you remember osteoblast, osteocyte, osteoclast? Remember? Osteoclasts are giant cells, right? They love to do what? Destroy the matrix. Remember? And matrix is mainly calcium, right? So destroys the matrix and release the calcium. Is it clear? So if parathyroid hormone increases osteoclast activity, osteoclasts will destroy or break the matrix of the bone. Matrix is filled with calcium, you know that. So that calcium will come out and will enter into the blood, that will increase the blood calcium. Increase the blood calcium. More parathyroid hormone, more osteoclastic activity, more breakdown of matrix of the bone, release of calcium into the blood. So blood calcium will go up. In kidneys, increases calcium reabsorption. Now remember, the word reabsorption means taken back into the body from the urine. Blood or body. The word reabsorption, very important word, means taken back into the body from the urine. So parathyroid hormone increases calcium reabsorption. That means in the kidneys, take the calcium back into the blood or body. Okay, so that will increase the blood calcium. Increase the blood calcium. If less reabsorption, calcium will get out from the body with the urine. Is it clear? So retention of calcium. Intestine, indirect, not direct effect, indirect action. How? Parathyroid hormone increases vitamin D synthesis. Vitamin D synthesis or production. And vitamin D works on the intestine to do what? Increase calcium absorption from the food present in the intestine or food we eat. So, very simple, PTH increases the production of vitamin D, and vitamin D helps in the absorption of calcium from the food we eat. So, if more vitamin D, more absorption of calcium from the food, that means more calcium will enter into the blood. Is it clear? More calcium absorption from the food means taken into the blood. So, calcium concentration goes up. Make sense? Okay. So, just think simple. Parathyroid hormone increases the blood calcium, right? So, from the bone, more calcium should enter into the blood. So, who breaks the bone? Osteoclasts. Breaks the matrix, right? So, osteoclast activity increases, that action is done. Is it clear? On kidneys, very simple, since the action is increasing blood calcium should take the calcium back from the urine, reabsorption. Make sense? Not let it get out with the urine. And intestine through vitamin D. Vitamin D absorbs the calcium from the food. So, those are the actions. Now, we know that calcitonin lowers the calcium. So, just opposite. So, you see here, if you know the action of parathyroid gland, calcitonin is opposite. Just know that calcitonin does not work on the intestine. Works on these two. So, opposite action decreases osteoclastic activity. Tell the osteoclast, don't be active, keep quiet. So, decrease break of the matrix, decrease blood calcium. On kidneys, decrease calcium reabsorption, let the calcium get out with the urine. Make sense? Let the calcium get out with the urine. So, we will lower the blood calcium. So, calcitonin just works on these two, not on the intestine, and just opposite action of parathyroid hormone. Okay. So, that's how the calcium is regulated by those two hormones, PTH and calcitonin. Adrenal glands, very important glands sitting on the kidneys, also called suprarenal glands. Now, this is the kidney, this is the adrenal gland, and I already mentioned as outer part is called what? Cortex. Inner part is the medulla. Remember that? Now, in the adrenal cortex, you have three layers. You have three layers. 1, 2, 3 in the cortex part, and this is medulla. Okay? You need to know what are those three layers in the cortex and the hormones. Three layers are zona glomerulosa, zona fasciculata, and zona reticularis. And three layers produce three different types of hormones, totally different from each other. That's why adrenal cortex is also called three glands in one, because three layers, right, produce totally three different types of hormones. So we can say adrenal cortex is three glands in one gland. Okay. One structure. Zona glomerulosa produce the mineralocorticoids that regulate the minerals in the body. That's why called mineralocorticoids. Zona fasciculata produces glucocorticoids. Glucocorticoids help in glucose metabolism. First, when glucocorticoids were identified, the action was found that these hormones help in glucose metabolism. Make sense? So that's why they were named as glucocorticoids. Gluco. But later, it was found that glucocorticoids have strong anti-inflammatory action. Have you heard hydrocortisone? You know, the ointment, very strong anti-inflammatory, right? If eye is red, conjunctivitis, you put there, will be gone, right? So, cortisone, hydrocortisone, those are glucocorticoids. Okay? Strong anti-inflammatory action, not only glucose metabolism. Okay? And the innermost layer is zona reticularis. This layer produces sex hormones. So zona glomerulosa, the middle layer is zona fasciculata, and innermost layer is zona reticularis. Mineralocorticoids regulate the minerals in the body. Glucocorticoids regulate the glucose metabolism as well as strong anti-inflammatory action, and zona reticularis, sex hormone production. Okay? So three layers, three different types of hormones are produced. Now the medulla, this part. In this part, you have sympathetic neurons. You know, autonomic, sympathetic, parasympathetic. Sympathetic neurons. And this adrenal medulla produces adrenaline and noradrenaline. I'm sure you have heard, right? Adrenaline, everybody. Similar hormone is noradrenaline. Also called epinephrine, norepinephrine, same thing. And norepinephrine. Okay. Adrenaline is epinephrine, noradrenaline is norepinephrine. Now you all probably know that adrenal secretion, if the adrenal secretion increases, what happens? Heart rate goes up, right? That's like excitement. You know, adrenaline secretion causes what? Excitement. Have you heard? Often we say this movie has a lot of suspense, right? Action, drama will increase your adrenaline pump. That means will increase the adrenal secretion, right? We use the term commonly. So adrenaline increases the excitement, right? Produces excitement in the body. Fight or flight response. So here you see those three layers and adrenal medulla. Hypersecretion of glucocorticoids. Hypersecretion of glucocorticoids can lead to Cushing syndrome. Cushing syndrome is a clinical condition in which the patient gets some symptoms. One is common symptoms. Three symptoms are very common. Cushing syndrome. One is moon face. The face, fat accumulates and the face becomes round. You see this pattern before and after. Okay? So moon face is number one. That's the Cushing syndrome. Number one. Number two, buffalo hump. In the back of the neck, lot of fat, thick pad of fat is formed. Fat accumulates in the back of the neck. That is called buffalo hump. H-U-M. Okay. Number three, acne. That's the pigmentation on the skin. Okay. So those are three common signs of Cushing syndrome. Moon face, buffalo hump, and pigmentation in the skin. Hyposecretion, prolonged hyposecretion of glucocorticoids leads to a clinical condition that is called Addison's disease. Addison's disease. Multiple symptoms are seen in Addison's disease. I'll just mention important ones. One is spasm of the muscles, particularly abdominal muscles. Spasm cause pain, abdominal pain. So that is number one, abdominal pain due to spasm of the muscles. Number two, that is called postural hypotension. Okay? When the person changes the body position, like from sitting to standing or from lying to sitting, right? Particularly in vertical direction, when the person changes the body position, the blood pressure drops a lot. Hypotension, okay? Postural hypotension, also called orthostatic hypotension, similar. Okay, so that is another symptom. Fatigue, the person gets very tired. Okay, so fatigueness, another symptom, Addison's disease. So just know that those are the clinical conditions related to glucocorticoids. Hypersecretion causes Cushing syndrome. Prolonged hyposecretion can cause Addison's disease. Gonads produce sex hormones. Male gonads or testes produce testosterone. Female gonads, ovaries, produce estrogen, progesterone. Okay. Another one, it's not listed here, but very important. You know that pancreas. What kind of gland? Everybody. Mixed gland. So pancreas is a mixed gland. Mixed type gland. So it has both endocrine and exocrine part. Both endocrine and exocrine. Endocrine part, since we are talking about endocrine system, endocrine part is, I have already mentioned, pancreatic islets. Also called pancreatic islets of Langerhans, but just know the easy one, pancreatic islets. Okay. Exocrine part is called acini, pancreatic acini. Pancreatic islet or endocrine part of pancreas produces two hormones, insulin and glucagon. Okay? Insulin, insulin does what? Insulin increases or decreases blood sugar? Insulin does what? How about this side? What do you think? Just say yeah, increase or decrease. Pick one. Why people take insulin? Why people take? You don't know why people take insulin?
Yes, I do.
Who take insulin?
People that need their blood sugar without.
What kind of patient?
Huh? What? What
Which?
kind of patient?
Yeah. What patients take insulin? You don't know? Who takes insulin?
Everybody that needs it.
How about you?
People that are diabetic.
Yeah, you have to say. Okay, so diabetic patients take insulin. Okay, that's not like a very difficult question. Diabetic patients take insulin, right? To do what? To increase sugar or lower the sugar? To lower the sugar or increase the sugar?
Lower.
Lower the sugar, right? Okay, so insulin does what? Lower the
Blood
sugar. Make sense? That's why diabetic patient, if the sugar goes up, they should not take it, right? That will be dangerous. Okay. So insulin lowers the blood sugar. You know that, right? Glucagon just does opposite. That means what? Increases the blood sugar. Make sense? So you see, the endocrine part of pancreas produces two hormones, right? Insulin and glucagon. One does what? Lowers the sugar. Another increases the sugar. Make sense? And by the action of these two, your blood sugar is maintained or regulated. Make sense? Now, if someone's blood sugar now you tell me, after you eat a meal, blood sugar goes up, right? So which hormones should be secreted? That is happening all the time. Insulin, right? To lower the sugar. Now, if you are starving, should insulin be secreted? That will cause problem, right? If the sugar goes down further. So, who should be released? Glucagon. Make sense? To increase the blood sugar. Will break your glycogen and other sources of sugar. Okay, so that's the pancreas, endocrine part of pancreas. Now, exocrine part of pancreas, pancreatic acini produce pancreatic juice. Pancreatic juice. Pancreatic juice helps in digestion. It has nothing to do with blood sugar. Works on the intestine and help in the digestion of food. Okay, so that's the function of pancreatic juice. Totally different. So exocrine part helps in the digestion of food by producing pancreatic juice. Okay. Okay. Now sex hormones. You know the function of sex hormones. Sex hormones help in the growth and maturation of reproductive organs. Regulate sperm production, ovum production, right? Cycles, ovarian cycles, menstrual cycles are controlled by sex hormones, female sex hormones, right? Secondary sex characteristics. What are the secondary sex characteristics? That the external features that separate a male and female from outside. How you separate a male and female, right? Those are the secondary sex characteristics. Can you name a couple of those? Male secondary sex characteristics. How you will separate a male from a female? By looking from outside. How they're different. Facial hair, right? Very good. Anything else? Say it loud.
The voice.
Voice. Male voice is loud, right? Female voice is high pitch. So loud voice. How about this? This structure is called laryngeal prominence or Adam's apple, right? So that is male secondary sex characteristics, right? Broader shoulder, more prominence of the skeletal muscles, right? Usually. now if a girl is start to take the male sex hormone, right, you'll see those features appear in the body, right, to some extent. So it tells that those hormones are responsible for these features, right. Female secondary sex characteristics include what? Voice, high pitch, right, subcutaneous fat under the skin, more fat is present, right, broader hip, female breast, right, mammary gland. So those are the female secondary sex characteristics. By looking at those, you can tell this is a female. So those are given by the sex hormones. And last, the sexual desire, behavior, and drive, right? All those are controlled by the hormones. So you know that. Sexual desire or behavior and drive. So just know that sex hormones are produced by the gonads. Male gonads are testes, female gonads are ovaries, and male sex hormone is testosterone, female sex hormones are estrogen, progesterone, right? And those are the functions of the sex hormones. Okay, everybody. We have learned a lot of things. Have to retain, right? That is important. That is a problem too. How much you can retain